Okay. We now come to the statement. I call the Secretary of State, Matt Hancock. Secretary.
Mr. Speaker, with permission, I'd like to make a statement on coronavirus. We're approaching the end of a year where we've asked so much of the British people. And in response to this unprecedented threat to lives and to livelihoods, the British people have well and truly risen to the challenge by coming together to slow the spread and support each other. I know how difficult this has been, especially for those areas that have been in restrictions for so long. The national measures have successfully turned the curve and begun to ease pressure on the NHS. Cases are down by 19% from a week ago, and daily hospital admissions have fallen 7% in the last week. January and February are always difficult months for the NHS, so it is vital we safeguard the gains we've made. We must protect our NHS this winter. We've invested in expanded capacity, not just in the Nightingales, but in hospitals across the land, and we've welcomed thousands of new staff. Mr. Speaker, this morning's figures show the number of nurses in the NHS is up 14,800 compared to just a year ago. Well on our way to delivering on our manifesto commitment of 50,000 more nurses. Together, while we invest in our NHS, we must also protect our NHS. So it'll always be there for all of us during this pandemic and beyond. Mr. Speaker, I'm so grateful for the resolve that people have shown throughout the crisis. Thanks to this shared sacrifice, we've been able to announce that we will not be renewing our national restrictions in England. And we've been able to announce UK-wide arrangements for Christmas, allowing friends and loved ones to reunite and form a 5-day Christmas bubble. And I know that this news provides hope for so many. But we must remain vigilant. There are still today 16,570 people in hospital with coronavirus across the UK, and 696 deaths were reported yesterday. That means 696 more families mourning the loss of a loved one, and the house mourns with them. So as tempting as it may be, we cannot simply flick a switch and try to return life straight back to normal. Because if we did this, we would undo the hard work of so many and see the NHS overwhelmed with all that that would entail. We must keep suppressing the virus while supporting education, the economy, and of course the NHS until a vaccine can make us safe. That is our plan. We will do this by returning to a tiered approach, applying the toughest measures to the parts of the country where cases and pressure on the NHS are highest, and allowing greater freedom in areas where prevalence is lower. While the strategy remains the same, the current epidemiological evidence and clinical advice shows that we must make the tiers tougher than they were before to protect the NHS through the winter and avert another national lockdown. So we've looked at each of the tiers afresh and strengthened them, as the Prime Minister set out on Monday. In Tier 1, if you can work from home, you should do so. In Tier 2, alcohol may only be served in hospitality settings as part of a substantial meal. And in Tier 3, indoor entertainment, hotels and other accommodation will have to close, along with all forms of hospitality except for delivery and takeaway. Mr. Speaker, I know that people want certainty about the rules they need to follow in their area. These decisions are not easy, but they are necessary. We've listened to local experts and been guided by the best public health advice, including from the Joint Biosecurity Centre. We set out the criteria in the COVID-19 winter plan, and we published the data on which the decisions are made. As the winter plan sets out, the 5 indicators are the case rate in all age groups, in particular cases amongst the over 60s, the rate at which cases are rising or falling, the positivity rate, and the pressures on the local NHS. When setting the boundaries for these tiers, we've looked not just at geographical areas, but the human geographies which influence how the virus spreads, like travel patterns and the epidemiological situation in neighbouring areas. While all three tiers are less stringent than the national lockdown that we're all living in now, to keep people safe and to keep the gains that are being made, more areas than before will be in the top two tiers. This is necessary to protect our NHS and keep the virus under control. Turning to the tiers specifically, the lowest case rates are in Cornwall, the Isle of Wight and the Isles of Scilly, which will go into Tier 1. In all three areas, they've had very low case rates throughout, and I want to thank residents for being so vigilant during the whole pandemic. I know that many other areas would want to be in Tier 1. I understand that. My own constituency of West Suffolk has the lowest case rate for over 60s in the whole country, and I want to thank Matthew Hicks and John Griffiths, the leaders of Suffolk and West Suffolk councils, and their teams for this achievement. But despite this, and despite the fact Suffolk overall has the lowest case rate outside of Cornwall and the Isle of Wight, our judgment, looking at all of the indicators and based on the public health advice, is that Suffolk needs to be in Tier 2 to get the virus further under control. Now, I hope that Suffolk and so many other parts of the country can get to Tier 1 soon, and the more people stick to the rules, the quicker that will happen. We must make the right judgments guided by the science. The majority of England will be in Tier 2, but in a significant number of areas, I'm afraid, they need to be in Tier 3 to bring case rates down. Now, I know how tough this is, both for areas that have been in restrictions for a long time, like Leicester and Greater Manchester, and also for areas where cases have risen sharply recently, like Bristol, the West Midlands, and Kent. The full allocations have been published this morning and laid as a written ministerial statement just before this statement began. I understand the impact that these measures will have, but they are necessary given the scale of the threat that we face. We'll review the measures in a fortnight and keep them regularly under review after that. I want to thank everybody who's in the Tier 3 areas for the sacrifices that they're making, not just to protect themselves and their families, but their whole community. And regardless of your tier, I ask everyone, we must all think of our own responsibilities to keep the virus under control. We should see these restrictions not as a boundary to push, but as a limit on what the public health advice says we can safely do in any area. But frankly, the less any one person passes on the disease, the faster we can get this disease under control together. And that is on all of us. Mr. Speaker, we must all play our part while we work so hard to deliver the new technologies that will help us get out of this, in particular vaccines and testing. The past fortnight has been illuminated by news of encouraging clinical trials for vaccines, first from Pfizer-BioNTech and then Moderna, and then, of course, earlier this week from the Oxford-AstraZeneca team. If these vaccines are approved, the NHS stands ready to roll them out as soon as safely possible. Alongside vaccines, we've made huge strides in the deployment of testing. Our rollout of community testing has been successful because it means we can identify more people who have the virus but don't have symptoms and help them isolate, breaking the connections that the virus needs to spread. As part of our COVID-19 winter plan, we'll use these tests on a regular basis, for instance, to allow visitors safely to see loved ones in care homes, to protect our frontline NHS and social care colleagues, and to allow vital industries and public services to keep running safely. Mr. Speaker, we've seen in Liverpool, where now over 300,000 people have been tested, how successful this community testing can be. And I want to pay tribute to the people of Liverpool, both for following the restrictions and for embracing community testing. It's been a big team effort across the whole city, and the result is that in the Liverpool city region, the number of cases has fallen by more than 2/3. In the borough of Liverpool itself, where the mass testing took place, cases have fallen by 3/4. It hasn't been easy, and sadly, many people in Liverpool have lost their lives to COVID. But thanks to people sticking to the rules and to the huge effort of community testing, Liverpool's cases are now low enough for the whole city region to go into Tier 2. This shows what we can do when we work together. We can beat the virus. And I want to pay tribute to the people of Liverpool, to NHS Test and Trace, the university, the Hospital Trust, and Mayor Joe Anderson, and so many others who've demonstrated such impressive leadership, responsibility, and a true sense of public service. We're now expanding this community testing programme even further to launch a major community testing programme honing in on the areas with the greatest rate of infection. This programme is open to all local authorities in Tier 3 areas in the first instance and offers help to get out of the toughest restrictions as fast as possible. We'll work with local authorities on a plan to get tests where they're needed most and how we can get as many people as possible to come forward and get certainty about their condition. The more people who get tested, the quicker a local area can move down through the tiers and get life closer to normal. Mr. Speaker, viruses can take a short time to spread, but a long time to vanquish, and sadly there is no quick fix. They call upon our determination to make sacrifices that will bring it to heel, and our ingenuity to make scientific advances that will get us through. Hope is on the horizon, but we still have further to go. So we must all dig deep. The end is in sight. We mustn't give up now. We must follow these new rules and make sure that our actions today will save lives in future and help get our country through this. And I commend this statement to the House.
The Secretary of State, Jonathan Ashworth.
Mr. Speaker, and can I thank the Secretary of State for advance sight of his statement, and I suppose we should all thank him for advance sight of the website, but sadly it crashed before we could check what tiers we were in. Now, the news of a vaccine is indeed light at the end of the tunnel, but we are still in the tunnel, and we have a significant way to go to drive infection rates down and keep our constituents safe. Now, we understand why tough restrictions are still needed. But let's be clear, today millions of people trying to survive in the second lockdown will soon be forced to endure further local lockdown restrictions. So does he accept that these interventions succeed when made in tandem with local communities? Because I remember when areas like Bury and Trafford went into lockdowns in the summer, the Secretary of State promised that MPs would be involved in the decision. Has that commitment now been abandoned? Then ministers agreed to involve regional leaders, but took exception to being challenged by Andy Burnham. So what role do regional leaders now have in these decisions? Or is it really the position that the Prime Minister imposes from Downing Street restrictions on communities across the Midlands and the North, restrictions that will have a huge impact on the livelihoods of families and small businesses? Christmas, he will know, is vital for pubs, for restaurants, for entertainment venues across these areas. They will need substantial financial support to get through this period. And will those areas that went into Tier 3 lockdowns before the national lockdown, like Greater Manchester, South Yorkshire, now get backdated economic support for their local small businesses? There are now parts of the country, like my own city Leicester, like Bury, like Lee, like Haywood, that have been under a form of lockdown for months and months and months, where families have been forced apart, where grandparents haven't seen their grandchildren. Those families tonight will want to know what the exit strategy is and what voice they will have in that strategy. Now, he has outlined 5 criteria by which local lockdowns will be judged. Will he publish clear, transparent rules for areas entering and leaving tiers, a scorecard, if you like, for every area, assessing their COVID progress against their criteria so everyone can judge it publicly? Now, he talks of mass lateral flow testing, which we welcome the advances, but over 2 weeks ago, he announced he was sending, I think, 930,000 of these tests to local authorities, yet only around 8,500 are currently being used a day. Could he explain why that is? He will also be aware, I'm sure he studied it, that Slovakia recently tested over 3 million people over a weekend using these tests. They incentivised people to get tested by offering greater freedoms. Is that part of the government's thinking for how these tests could be used? Now, evidence from Liverpool suggests that there is a lower penetration of take-up of these tests in poorer, harder to reach communities. See, isn't the problem, Mr. Speaker, that if people and their contacts feel they will be financially penalised for a positive test, that they will avoid a test, they'll switch off the app, they won't answer their phone to unrecognised call centre numbers. And the reason people just soldier on when ill isn't because of stiff upper lip, it's because they can't afford to feed their families otherwise. So surely, after months and months, it is now obvious that people, low-paid people, like care workers on 0 hours contracts, need better support to isolate. So why didn't the Chancellor increase statutory sick pay in the spending review yesterday? The test and trace budget has now increased to £22 billion. That's more than the annual budget for the police and the fire service combined. Yet the OBR yesterday confirmed that their forecasts are based on the fact that, quote, a less effective test, trace and isolate system necessitates keeping a more stringent set of public health restrictions in place over the winter. So at what point will he accept that the current model, that the Serco model, has failed? I'm not against using the private sector, but I am against throwing shed loads of taxpayers' money at failing private sector contracts, Mr. Speaker. Local authorities, especially those now in Tier 3, should be leading this retrospective contact tracing work, and they should be given the data from day one so they can get on with it. And by the way, Mr. Speaker, why was there no uplift yesterday in the public health grant? Surely this is a time when we should be investing in public health, not freezing the grant. Now, on the easements for Christmas, there will indeed be relief from families across the country, but he will understand that there will also be nervousness across the NHS. We need a clear public health message. Asking people to be jolly careful is not good enough. He will know that January is an immensely busy and pressured time for our NHS. It's not just the patients filling up COVID beds, it's the emergency pathways which are already running at hot. It's the immense elective backlog. We know there are less beds because of social distancing. We know staff are exhausted. 1 in 7 hospitals have restricted electives or planned operations so far this winter. So what plans are in place to protect the NHS through January, especially if there is a long, cold winter snap? How many elective operations does he anticipate will be cancelled in January? Now, nobody in this House wants to see a third lockdown. So can he guarantee that the measures he has announced today will be enough to bring the R down and sustain it below 1 for the coming months until a vaccine allows life to return to normal?
Thank you very much, Mr. Speaker. The goal of the government is to bring R to below 1 to suppress the virus until a vaccine can keep us safe. That is the strategy. Taking the precise points that the honourable gentleman raised, he asked for an exit strategy. The statement I outlined is the exit strategy. It is to keep this virus suppressed with the minimum damage possible to the economy and indeed to education, whilst we work as fast and as hard as we can towards a vaccine and the use of community testing widespread across the piece to help to keep the virus under control. I would have expected him, Mr. Speaker, to have welcomed the massive progress in Liverpool that has shown that a combination of sticking by the rules and community testing at very large scale can help to bring this virus right under control. Instead, he criticised that it doesn't get into harder to reach communities. That is exactly where we need to get into, and that's why we do it in combination and hand in hand with the local authority. And I praised Joe Anderson. I'd also praise other local leaders, Ben Houchin in the Tees Valley, who's working with us on this, Andy Street and leaders across the West Midlands, Dan Jarvis in South Yorkshire, who we're working with to get a community testing system up and running in places like Doncaster. I want to see this community testing, which has been successful in Liverpool, rolled out right across the Tier 3 areas as much as is possible, and I invite all councils to engage. We engaged with councils and invited them to engage ahead of the decisions today, and we also invited all colleagues from around the House to put their input in. But it is important that we have clear public health messaging, because unfortunately we did see the impact on the number of cases going up and continuing to go up in those areas where local leaders were not working alongside us. And it was a sharp contrast to what happened, for instance, in Liverpool, but also in other areas where the local leadership were so constructive and positive. He asked for a scorecard in terms of the exit strategy. I think that's a good idea. We published this data. If we can make it into an even more accessible format, I think that is a good idea. He asked about supporting the NHS. Absolutely, and I'm delighted that yesterday my Right Honourable friend, the Chancellor of the Exchequer, with the support of the Prime Minister, put another £3 billion into the NHS on top of the £6.6 billion that's already being invested, and that money starts flowing this financial year for this winter and then runs into next year. He also mentioned the need to support people who've tested positive. We've put in place a £500 support payment. And on test and trace, NHS test and trace, Mr. Speaker, I thought from the figures this morning he would have welcomed the fact that the majority of in-person tests are now turned around within 24 hours. Really significant progress on the speed of turnaround in testing, for which I am very grateful to my team. There will be further support for local councils that find themselves in tiers 3 and 2 to support the action that is needed. But all in all, Mr. Speaker, let us come together and work together to get this virus under control, keep it under control, so that we can get life back to normal as soon as possible.
Jeremy Hunt, Chair of the...
Thank you, Mr. Speaker. Can I welcome the Prime Minister back from his splendid isolation to the place he has no doubt been itching to get back to more than any other, this House of Commons, and say how wonderful it is to see him here. And
great to see you.
Thank you, Madam Deputy Speaker. I think from a sedentary position, the Prime Minister said he was delighted to see me here. These are very difficult decisions, and indeed delighted to see me here on the back benches. These, turning to more serious matters, Madam Deputy Speaker, these are very difficult decisions, and part of the leadership you have to show in a pandemic is telling people unwelcome news, and I want to salute the Health Secretary's cautious approach to Christmas, because much as we all want Christmas to be as normal as possible, nothing would be more crazy than to take our feet off the accelerator at this moment and then see a spike in deaths in February. And so I think this is the right approach. There is one bit of further good news on top of the news about vaccines, on top of the news about mass testing, which I know he would like to be able to give and would be enormously welcome, and that is if every single person living in a care home could be sure that they could be visited by a close relative before Christmas. Now, I know he wants to do that, but there are huge logistical challenges in getting that mass testing technology to work in time. Could I just urge him to do everything he can, because that would make such a big difference to the nearly 400,000 people in care homes.
Madam Deputy Speaker, I hesitate to interrupt the love-in between the Prime Minister and my predecessor. But I'm grateful to his support. I'm grateful to their support. And this is a set of difficult measures, but I think the public understands why we have to take them. And why they are necessary. On the point about getting visiting going in care homes, he's absolutely right. You know, sometimes we talk about these tests and this new technology in an abstract way, or from a scientific point of view, but it really matters, and it really improves people's lives. And where we can use testing to make visiting safe in care homes, that is an example of the sort of thing that these new technologies can help to get life a little bit back towards normal. Of course it's got to be done in a safe way, and of course it's got to be done carefully, but we are now developing the protocols for exactly how that can happen, and working hard with the goal that everyone should have the opportunity to visit a loved one in a care home before Christmas.
And now we go to Dr. Philippa Whitford.
Thank you, Madam Deputy Speaker. Many scientists have expressed concern that the easing of restrictions at Christmas could lead to another surge of COVID cases in January. With cases still over 80% of the level at the start of lockdown, is the Secretary of State not worried that allowing outdoor events of 2,000 participants and indoor events of 1,000 in level 2 high-risk areas could actually drive up infection rates ahead of Christmas? While the lateral flow testing is very welcome in how it increases capacity, the Secretary of State previously stated the mass testing in Liverpool was a pilot and would be evaluated before being rolled out elsewhere. As the city has also been under tight restrictions and then lockdown, how will the impact of mass testing alone be evaluated? How does he plan to counter the lower uptake among deprived communities, the very ones at highest risk seen in Liverpool? And with no clinical evaluation yet published, how can he justify putting out contract tenders for an eye-watering £43 billion and rolling out this approach to 67 other areas? Should this strategy not be compared with investing money and energy in getting the traditional test, trace and isolate system working properly? Currently, over 40% of contacts in England are still not even informed they should be isolating. Finally, he knows it's not testing, but isolation which stops the spread of the virus. And if people who are infected or could be carriers are not isolating, no amount of testing will stop viral spread. The study by King's College, which suggested less than a quarter of people were isolating when advised, was incredibly worrying. So what assessment is the government doing to clarify current isolation rates and understand the reasons why people may not follow the advice they are given?
Thank you very much, Madam Deputy Speaker. Well, of course, we're constantly evaluating the impact of people isolating and how many people isolate when asked to. I would just encourage the Honourable Lady to look at a broader range of studies than just that one from King's College, and especially when you look at the self-isolation of those who test positive, which does tend to be higher. She asked about the use of these lateral flow tests to have a negative impact on the number of cases in an area. Of course, we've been evaluating this all the way through the study in Liverpool, and that's why we can have confidence in rolling it out more broadly across Tier 3 areas. I included in my statement a high-level assessment of this, which is that if you look at Liverpool City region, the number of cases is down by 2/3, but in the city itself, where the testing took place, it took place of people who live in the city and of people who work in the city and live largely in the wider city region. The number of cases is down by over 3/4. Now, that's one piece of evidence. It is clear that it's the combination of people following the rules and the community testing put together with the appropriate incentives to get people to take up the mass community testing. That is what can help to make this work, and we want to work with local directors of public health to understand and to know how this can work effectively in their areas, precisely to reach the hard to reach that she mentioned. Finally, I would echo, Madam Deputy Speaker, the request from the Honourable Lady that we be cautious this Christmas. But I would say to her that having agreed an approach across the whole UK, including with the SNP government in administration in Edinburgh and with the Welsh Labour administration and the cross-party administration in Northern Ireland, I'm delighted that there is an approach all the way across the UK, because there are so many ties that bind us together, which mean that we are stronger as one united kingdom working together to tackle this virus.
Greg Smith.
Thank you, Madam Deputy Speaker. It's incredibly disappointing news that Buckinghamshire, having entered the national lockdown in Tier 1, will emerge from the national lockdown into the more punitive restrictions of Tier 2, a decision that will be hard to understand in the rural communities of North Buckinghamshire that have relatively low infection rates, and a decision hard to understand given that there has been zero consultation between central government and Buckinghamshire Council and our local NHS. Appreciating that my right honourable friend has impossible choices to make to control this virus, will he commit to ensuring that Buckinghamshire Council and our local NHS is fully consulted as these tiers are reviewed going forward?
Well, yes, of course, along with